So this is a technique for transverse friction massage for the supraspinatus tendon insertion. To be able to expose the greater tuberosity from underneath the acromion, we're going to ask our patient to scoot a little bit forward in the chair and then bring his arm behind his back and then lean back. So if your patient has posterior superior capsular tightness and cannot do this, you can't perform the technique. So what we're going to do is we're going to come in. So now we've brought the greater tuberosity out from underneath the acromion. We follow the anterior V-notch. We drop down about 1 centimeter. And what we find is we'll palpate a little plateau. On that plateau is where we find the insertion of the supraspinatus tendon. I come in, I find the most tender spot. Here, I'm going to take my index finger reinforced by my middle, and I'm going to use my thumb on the posterior aspect of the scapula to stabilize. I'm going to, if I'm trying to work on the superficial or bursal side of the tissue, I'm going to compress, and I'm going to go in a caudal direction, and then I'm going to release. Compress, and I'm not breaking contact at all with the skin. Compress, move caudal, and release. Compress, sweep, release. So this is the technique for the superficial fibers of the supraspinatus. For an articular-sided problem for the supraspinatus, I'm going to change my direction slightly. I'm going to go in a caudal and then more posterior direction, and then release. So caudal, coming more posterior and releasing. Again, still maintaining contact with the skin.